Hi, I'm Kilgore. I'm a bariatric patient at the University of Chicago. I'm an employee at the University of Chicago, and so my insurance is here. Fortunately, one of the best bariatric centers in the country is here as well. So when my doctor, my regular primary care physician, first mentioned it to me, she immediately wanted me to see Dr. Alberti. I have a long history of fluctuating my weight up and down all the time, and I've lost 100 pounds, I've lost 80 pounds, and only to gain it all back. With my family history, though, with obesity being a primary cause and all the comorbidities that come with it, such as type 2 diabetes, high blood pressure, the acid reflux, let's not mention the pain in the joints that you live with daily, I found that my life expectancy, the doctor had given me about 10 years. Well, I have 12 grandchildren that I want to see marry and have their own homes. And so I need to be around a little longer than 10 years, and decided that I needed to do something more permanent. This was the option. My primary care physician only ever talked about the duodenal switch. I had never heard of it. I'd had friends that had had gastric bypass surgery back in the 70s and 80s, and one that had recently had the newer gastric bypass surgery called the Roux-en. But I'd never heard of duodenal switch. So I began to do some research. The research in Europe as well as the research here in the United States, and realized that for the long haul, for the long term, that was the best solution for me. It was the best solution for me to realize that I was going to have a long-lasting change of life. So it was a no-brainer. You just do the duodenal switch. Yes, it's the more invasive of the surgeries, but in the long run, you're just better off. The day I checked in for my surgery, I weighed in at 237 pounds. And today I fluctuate somewhere between 125 and 130, just depending on the month and what's going on, whether I'm active or not so active. So I've lost about 110 pounds. I've maintained that now for 2 years. My anniversary date will be 2 years, the 24th of this month. So I eat consistently, checking my protein, making sure I get that in. Make sure I get plenty of water and my vitamins. That's the 3 keys right there. As far as worrying about any of the other things like carbohydrates and that, I really don't, because there's not a lot of room. If you fill up on your protein and your waters and good vegetables and fruits, there's just not a lot of room for junk. But if you want a bite of it, okay. Life prior to surgery is as full as it is now, except that it was painful. A day never went by that I didn't have extreme pain from the middle of my back all the way down to my knee. That had been going on for about 20 years. So mobility was difficult, but I never would let it stop me. Realized that I couldn't walk up stairs or mountains or ride a bike or, oh heaven forbid, ice skate or roller skate. There's that stigma out there that you're taking the easy way out. There's nothing easy about this. It's a major move. It's a major lifestyle change. So I'm ecstatic. I have my life back. I can do things I haven't been able to do in 20 or 25 years. I can't imagine going backwards. I felt very comfortable with the staff from the beginning. If I had a question and they didn't have the answer to it, they found the answer for me. They either emailed it to me or they telephoned me. You know, and through going through all the processes, you always have the consultation where they kind of lay out the program for you. And then you visit each key element of the program, which is the psychologist. They want to make sure that you understand that this is not an easy surgery. This is something serious, that there are complications that could happen. But they answered all your questions. Then they made sure that you saw a dietitian and a nutritionist to make sure that you understood how certain foods reacted and the key values of those. So from that process right through to meeting Dr. Alverdi and the team of nurses that were around him, they answer your questions, and then you feel like you're part of this group. Instead of a patient, you're now part of this group that sustains you. You know, often when you have, you go in for a procedure like this, it's more like a mill, like you're next. And here, they always call me by name. It's amazing how they seem to know who I am. Just having that familiarity and knowing that they care enough to call me by name means a lot to me. When you're thinking about weight loss surgery, you have a lot of questions. When you've immediately had weight loss surgery, you have a ton more. And every ache, pain, every time you eat something is different than it was before, and you're scared. You need to have someone that you can call and say, is this okay? Is it all right that I feel XYZ? And so it's nice that you have the nurses, the support staff, the doctors. They all seem to be able to interact with each other and keep you right there where you need to be instead of making you wait. There are several different places you can go around the world, as well as here in the United States, to have bariatric surgery. There's not as many options for the duodenal switch because it's a more complicated surgery. So I'm blessed to have the University of Chicago physicians and this bariatric center here. And anytime I hear someone within 200 miles of Chicago looking into this type of surgery, I always recommend that they check the University of Chicago's bariatric team out first. Chicago's a great city. There's plenty of hotels they can stay at if they need to. There's plenty of support here. It's just the ideal place rather than traveling thousands of miles because you just don't know where to go. So I feel comfortable at a 200 or a 300 mile radius of saying, check out the University of Chicago. Don't settle for anything less than the best.